I would say the big things to remember from a management standpoint is isotonic crystalloid, right? I mean, we're living in an LR era, and I think LR would do just fine for us here. If you got normal saline's fine. What I wouldn't give is like half normal saline. What I wouldn't give is colloids probably don't do any harm, but there have actually been trials of colloids versus crystalloids in dengue, and there's no real advantage. Hypertonic hasn't really been studied, so it would probably be fine. And if you're worried about, if you were worried about cerebral edema somewhere in your differential, I don't think hypertonic fluid would do you any harm. But hypotonic fluids, half normal, that's out. NSAIDs are out. Steroids are, that's been tried as well as giving people glucocorticoids, and they do not help. They do not help. They don't make people feel better faster. They don't hasten recovery. They probably prolong viremia, to be honest with you.
Okay. I mean, it makes sense. You squish the immune system.
Yeah.
Things don't go better.
Yeah.
So just kind of walking backwards quick.
Yeah.
We talk about nausea, vomiting. Would that be affected by something like ondansetron or any of the nausea?
Ondansetron would be perfectly acceptable, right?
Okay.
And again, symptomatic management. No contraindications to any of our routinely used antiemetics.
Yes. Yeah. So hopefully we can keep this guy on like PO fluids.
Yeah.
Hopefully longer. Another thing I was thinking of, if he's leaking plasma, like his hematocrit is climbing, that also, there is a point where that's not good on its own either. Yeah. Giving him something like FDP, I'm not really thinking of so much hypotensive resuscitation. I'm just thinking of, maybe small boluses to keep that hematocrit from getting too high, where now he starts making clots and throwing clots.
Yeah, thrombosis is not really a feature of dengue. I mean, it's usually more of a bleeding side of things. So I wouldn't necessarily worry about that. And quite frankly, if you're in a place where someone would be on, if someone is sick enough to require admission, I think there's a reasonably good chance they probably have some contraindication to like DVT prophylaxis, just because they're usually pretty thrombocytopenic as well as having a rising hematocrit. We had, when I was on active duty, we had an outbreak of hemolytic uremic syndrome among some service members. And there wasn't a lot of data on how to manage HUS, infectious caused HUS in adults at the time. We have since published some of that based on our experience. But I do remember getting advice based on the pediatric data saying, just keep pushing fluids. You can't hurt them. And I was kind of taking that with a grain of salt as an adult intensivist. But I remember when I walked in one morning on rounds and was immediately crash intubating a 19-year-old. Yeah, I think we can sort of definitively disprove the fact that you can indeed, you can't hurt young people with fluid.